Assalamu alaikum students. Today we will discuss the bones of the face. Now this is the second part of the skull. The skull consists of cranium and the facial skeleton. So today we will discuss the bones of the facial skeleton. Now the bones of the face, the skeleton of face is formed by 13 bones in addition to the frontal bone, which have been already described in the cranium part of the skull. Now you can see here the bones forming the part of the facial skeleton is the number one is the part of the frontal bone, then two nasal bones. Here you can see this is present on our bridge of the nose, posterior part of the upper part of the bridge of the nose, then the lacrimal bone, which is present, there are two in number, one on each side, present in the orbital cavity, then the maxilla, two maxilla, then the palatine bone, which forms partially the palate, and the perpendicular plate of the palatine bone forms the part of the nasal septum, posterior part of the nasal septum. Then the zygomatic bone, and again a bone present in the nasal cavity which is known as inferior concha, and the vomer. Now this vomer and palatine bones together, they form the posterior part of the nasal septum. And lastly the mandible. And this mandible and the maxilla bone, they contain the alveolar sockets for the teeth. Now the zygomatic bone, it originates as two bones that fuse before birth. They form the prominences of the cheeks and part of the floor and lateral wall of the orbital cavity. Now here you can see it has got processes, and they are forming the lateral wall and the floor of the orbital cavity, and this bone forms the prominence of the cheek. The maxilla, the maxilla or the upper jaw bone, it originates as two bones, but fusion take place before birth. Now the maxilla forms the upper jaw, the interior part of the roof of the mouth, the lateral wall of the nasal cavity. Here you can see upper part of the roof of the mouth, the lateral wall of the nasal cavity, and the part of the floor of the orbital cavity. So it is also forming the part of the floor of orbital cavity, and the alveolar ridge or the process projects downwards and carries the upper teeth. So these are the alveolar ridges or processes which have got the upper teeth. On each side is a large, now inside the maxilla, on each side there is a large air filled cavity. Here you can see this is the part, this is the maxilla bone of the two sides, and on each side there is a space or a cavity in the bone which is known as the sinus, and on each side there is a large air sinus, it is known as the maxillary sinus. So this maxilla is forming the boundary with the it is uniting with the nasal bone and the frontal bone, and here with the zygomatic bone. The nasal bones, there are two nasal bones, small flat bones that form the greater part of the lateral and the superior surface of the bridge of the nose. So here you can see that this is the bridge of the nose. It is formed by the two nasal bones. So these are the two small pieces, and they are forming the bridge of the nose, and they also form the boundary of anterior nares. Now anterior nares is the opening into the nasal cavity. Now the lacrimal bones, here you can see, so far we have studied the frontal bone, the zygomatic bone here, the maxilla. You can see this is the maxilla, and here are the nasal bones. Now lacrimal bone is a small piece of bone. There are two small bones. Uh, they are posterior to and lateral to the nasal bones, and they form part of the medial walls of the orbital cavity. So here you can see it is the orbital cavity, and this is the medial wall, and they form the part of the medial wall of the orbital cavity. Now it has a foramen for the passage of nasolacrimal duct. Now this nasolacrimal duct is the tube which conveys the tears from the eye into the nasal cavity. Humor, as I have told you, this is the humor bone, and it forms the posterior part of the nasal septum. It is a thin flat bone that extends upwards from the middle of the hard palate. So it goes down into the nasal cavity as the part of nasal septum. Superiorly, it articulates with the perpendicular plate of the ethmoid bone. So this is the perpendicular plate of ethmoid bone, perpendicular plate of ethmoid bone, and it is articulating superiorly with it. Bones, the palatine bones, here you can see these palatine bones are two small L-shaped bones. Now these are small L-shaped. You can see here this is the L-shaped bone, and the horizontal part unite to form the posterior part of the hard palate. So here you can see it has got an horizontal part and a vertical part. The horizontal part is uniting with the other horizontal part of the other side of the bone, the other bone which is located on the opposite side, and it is forming the perpendicular plate of the uh, it is forming the horizontal plate of the palate. It is forming the posterior part of the palate, hard palate, and the perpendicular part projects upwards to form the lateral part of the lateral wall of the nasal cavity. So this is the perpendicular plate which is projecting upward and forming the lateral walls of the nasal cavity. At their extremities, they form the part of orbital cavities. Now here they form the part of the orbital cavities on their extremities. So inferior concha, now the when we will study the nasal cavity, we will see that its lateral wall is formed by the uh, its lateral wall presents three features, three bones, that is the superior concha, middle concha, and the inferior concha. The superior and middle concha, they are the part of ethmoid bone, while the inferior concha, it is a scroll shaped separate bone which forms part of the lateral wall of the nasal cavity and projects into it below the middle concha. The superior and middle concha, as I have told you, they are the parts of ethmoid bone, but the inferior concha, it is a separate independent bone. The the conchae collectively increase the surface area in the nasal cavity, allowing the inspired air to be warmed and humidified more effectively. Now, mandible or the lower jaw bone, this is the lower jaw and the only movable bone of the skull. It originates as two parts that unite at the midline. Now, these they unite at the midline. Each half consists of two main parts, the curved body, here you can see the curved body, and the ramus. The ramus has got two processes, the coronoid process and the articular process, which articulates with the fossa in the skull to form the temporomandibular joint. Now the body, it is a curved part with alveolar ridges containing the lower teeth and a ramus which projects upward almost at right angle to the posterior end of the body. Now at the upper end of the upper end ramus divide into condylar process, as I have told you before, which articulates with the temporal bone to form the temporomandibular joint, and the coronoid process which gives attachment to the muscles and ligaments that closes the jaw. The point where the ramus joins the body is the angle of the mandible. So white bone, this is an isolated horseshoe shaped bone lying in the soft tissue of the neck just below the larynx and below the mandible. So here you can see the location of the white bone. It is a horseshoe shaped bone and it lies just below the mandible and the larynx. Now the white bone, it does not articulate with any other bone, but it is attached to the styloid process of the temporal bone by ligaments. It supports the larynx and gives attachment to the base of the tongue. So the various parts of the white bone, here you can see that it has got a central part which is known as the body, and two horns, a smaller one, the lesser horn, and a larger one, the greater horn. Sinuses of the skull. Now, the sinuses, as I have told you, these are the air-filled cavities in the bones of the skull, and they are present in the sphenoid bone, ethmoid bone, maxillary, and the frontal bones. So there are four sinuses: the sphenoidal sinuses, ethmoidal sinuses, maxillary sinuses, and frontal sinuses. These are the one in the um, frontal, maxillary, and the ethmoid are paired ones, while in the sphenoid sinus, this is the single sinus. Now these sinuses, they are all they communicate with the nasal cavity, and they are lined with ciliated mucous membrane, and they give resonance to the voice and reduce the weight of the skull, making it easier to carry. Now, in the last, we will summarize the skull in the form of its functions. So, number one function is that the cranium protects the delicate tissues of the brain. Now, you know till now that the cavity of the skull, it contains the brain. So, the cranium protects the delicate tissues of the brain. Now, the bony eye sockets provide the eyes with some protection against injury and give attachment to the muscles that move the eyeball. The temporal bone protects the delicate structure of the ear. As I have told you that the internal ear, middle ear and internal ear is present in the petrous part of the temporal bone. So it also gives protection to the structure of ear. The sinuses in some bones of the face and skull give resonance to the voice, as we have discussed. Now the bones of the face, they form the walls of the posterior part of the nasal cavities and form the upper part of the air passages. The maxilla and mandible provides alveolar ridges in which the teeth are embedded. And last but not the least, the chewing of food is performed by the mandible, and this is controlled by the muscles of the lower face, which are attached to the bones of the skull.